Module Overview. This module is a foundational cornerstone in the Pre-Nursing Foundation program, providing you with a comprehensive introduction to human anatomy and physiology, the structural and functional blueprint of the human body. As a nurse, understanding the normal anatomy, structure, and physiology function of the human body is essential for interpreting symptoms, identifying deviations from the norm, delivering accurate care, and communicating effectively with medical professionals. The module emphasizes clinical relevance, organ system interdependence, and nursing implications. You will explore all major body systems, learning how they work individually and collectively to sustain life. There will be a strong focus on terminology, homeostasis, anatomical directions, and basic diagnostic correlations, ensuring you are not only memorizing structures, but also developing critical thinking skills and clinical reasoning. Designed to meet European Union academic and professional healthcare standards, this module also introduces cross-disciplinary knowledge from biology, chemistry, and medical science to bridge theory with patient care. Diagrams, simulations, animations, and practical labs will enhance visual and tactile learning in line with modern pedagogical standards. 1. Introduction to Anatomy and Physiology Definitions. Anatomy versus Physiology importance in nursing. Understanding health, illness, and treatment. Levels of organization. Cell aerotissue. Aero-organ, aerosystem, aero-organism. Anatomical terminology. Positions, directions, and planes, e.g. anterior, posterior, sagittal, coronal. Body cavities and membranes, cranial, thoracic, abdominal, pelvic. 2. The cell. The basic unit of life cell theory and cellular structures. Nucleus, mitochondria, ribosomes, endoplasmic reticulum, functions of organelles, cell types, epithelial, muscle, nerve, connective, mitosis and meiosis DNA, RNA, and genetic expression role of cells in health and disease, for example, cancer, anemia, sickle cell. 3. Integumentary system, skin, hair, nails. Layers of the skin, epidermis, dermis, subcutaneous skin functions, protection, thermoregulation, sensation, vitamin D synthesis, common conditions, burns, pressure ulcers, dermatitis, infections, wound healing process, and nursing assessment of skin integrity. 4. Skeletal system, bone classification and functions, protection structure, hematopoiesis, anatomy of a long bone, diaphysis, epiphysis, marrow joints, types, synovial, hinge, ball and socket, axial versus appendicular skeleton bone disorders, osteoporosis, fractures, arthritis, relevance in positioning, mobility, and fall prevention. 5. Muscular system, types of muscles, skeletal, smooth, cardiac muscle contraction, actin-myosin interaction, ATP role, muscle tone, hypertrophy and atrophy, interaction with skeletal system, movement and posture, clinical relevance, muscle spasms, strain, rehabilitation, mobility aids. 6. Cardiovascular system, heart anatomy, chambers, valves, conduction system, SA node, AV node, circulatory loops, pulmonary and systemic circulation, blood vessels, arteries, veins, capillaries, blood composition, plasma, red-white cells, platelets, blood pressure, pulse, heart rate, vital signs, disorders, hypertension, heart failure, anemia, nursing considerations, BP monitoring, pulse assessment, hemorrhage care. 7. Respiratory system, upper versus lower respiratory tract, mechanism of breathing, inhalation, exhalation, diaphragm role, gas exchange in alveoli, oxygen and carbon dioxide diffusion, control of respiration, medulla oblongata, chemoreceptors, lung volumes, and respiratory rate. Common issues: asthma, COPD, pneumonia, choking. Clinical relevance: oxygen therapy, suctioning, respiratory assessment. 8. Digestive system, organs and functions, mouth, esophagus, stomach, small large intestines, rectum, accessory organs, liver, gallbladder, pancreas, digestive enzymes and absorption, peristalsis and mechanical chemical digestion disorders, ulcers, GERD, constipation, malabsorption, nursing, NG tubes, stomach care, dietary assessments. 9. Urinary system, organs, kidneys, ureters, bladder, urethra, nephron structure, and filtration process. urine formation and excretion, fluid and electrolyte balance, clinical relevance, dehydration, UTI, renal failure, catheterization.